This episode of the Senior Rehab Podcast is sponsored by the Academy of Geriatric Physical Therapy. AGPT's mission is to further your ability to provide best practice physical therapy and to advocate for optimal aging. How do they do this? Well, one way is by connecting like-minded individuals around a specific topic. We call these special interest groups, or SIGs. One SIG is a health promotion and wellness special interest group. I highly encourage y'all to check out some of the work they've done, especially with their presentation on physical activity, a key to successful aging. You can access this presentation for free and learn about how the AGPT can further your clinical practice at geriatricspt.org/SRP. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
Hey everyone, and welcome to the monthly meetup of the Game Changers. Today we are discussing an article entitled Muscle Strength as a Predictor of All-Cause Mortality in an Apparently Healthy Population, a systemic review and meta-analysis of data from approximately 2 million men and women. Been a lot of interesting conversation so far about it, so we'll bring you all in on it. Christopher, you're up first.
All right, so I'm Chris, new grad over here. I don't feel like giving a lot of background information. I'm going to try to stay as mysterious as possible. It's a very large sample size from 38 studies with about 2 million participants that are included in this meta-analysis. And the inclusion criteria for these particular studies are, number one, exposure of muscular strength measured using a validated strength test. Two, the main outcome that was measured was all-cause mortality risk assessed with hazard ratios. Three, the participants were relatively healthy youth and adults, excluding studies in which all participants had chronic diseases such as diabetes, heart failure, hypertension, peripheral artery disease, chronic obstructive pulmonary disease, cancer, and patients with critical illnesses. Four, they were prospective cohort studies. The follow-up period of these particular studies were greater than 10 years.
There's a lot of data they're analyzing there, which is good. Nice sample size, lots to work with. So we definitely can't fault this one on not having details. Mm-hmm. So Jamie, you made a good point talking about the inclusion-exclusion criteria. Why do you think that they chose to take out people that had, like a study that had large populations of people with underlying or critical illnesses?
This is Jamie. So for those of you who are listening to this thing and have listened to other ones, you're probably getting tired of the sound of my voice. It's okay, me too. So what we're looking at here, though, is a meta-analysis. So we're taking a large group of large population through various studies and kind of filtering out some of the other bits that may skew your results in smaller sample sizes. So if you're looking to establish like a baseline measure for a particular segment of the population or for a particular effect, then what you want to do is start with what is normal. What would a normal person expect to experience in terms of their life and their health if they were otherwise a normal individual without these other health issues that we may read about or hear about, like CHF or COPD, diabetes. So you're now establishing a baseline comparison between gender and age over a long period of time, about 10 years. I think the longest study was about 43, so the average somewhere around 11. And so doing, you've now established a framework by which you can now compare other populations that might be a subgroup, like racial issues, additional gender issues, smaller populations of age. You can also look at other aspects, whether it's demographics in terms of socioeconomic, education, zip code where they live. So in that regard, it gives you some really good data to start with, so you can do some additional follow-up research.
So Jamie, basically what you're saying is that by having such exclusion criteria, this study is allowing us to set a norm for grip strength and see if grip strength actually has an effect in a healthy population. So then we can look at it in smaller populations and sicker populations, things like that.
Yeah, that's correct. Because if you included all the other subgroups based on their comorbidities, then you'd have a real hard time discerning whether or not mortality was a result of heart failure, and that a life expectancy was shortened because of other issues related to that, or was it something related to their overall strength and condition?
So why do you think grip strength is an important thing to be looking at? You made an interesting comment about looking at grip strength like you look at blood pressure. Fill us in on that train of thought.
Yeah, so I look at grip strength as one of those summary measures of how people are doing, in the same way that we can kind of look at gait speed, because gait speed involves a lot of factors. Likewise, grip strength may incorporate into it a lot more information about the person's either lifestyle or about their overall physical condition. You know, people who will tend to be a lot more active, especially doing even the stuff around the house, ADLs, they clean, they do some gardening, they walk. We might expect that overall their grip strength would be higher than someone who is sedentary and doesn't do a lot of things to keep themselves fairly active. So for me, it is kind of like that barometer of just how am I doing in life in general with my physical ability.
I like how you're looking at that. Okay, Matt, you had some things you noticed about the normative data, or should I say lack of normative data proposed by this study?
Yeah, that's right. And just to give a bit of a background of what my thinking is, one of the things I really like about these Game Changer meetups is I'm responsible for overseeing clinically a fair number of physical therapists and assistants. So I kind of take this information that we talk about here, and I could bring that to the group that I oversee, create journal clubs, that sort of thing. So one of the things I'm thinking about is, what do I tell the therapist in terms of normative data when it comes to hand grip strength or knee extension strength that they're talking about in this meta-analysis? And I really didn't see anything in terms of a table of numbers. I saw some graphs related to hazard ratio and age of the person or length of follow-up, but not actual cutoff scores. And I wanted to make sure that I'm not missing anything, didn't read it in the article, or see what you guys thought about that.
No, I think, what we mentioned was that we didn't really see that in there. We kind of saw this article as a launch pad for further articles, and just establishing that there is that correlation so that we can use it for further research, or we could use it, maybe look at some other research and know that those articles do have a solid basis collectively, because I have found articles with some norms in them, and just knowing that this is based in something solid gives those articles more credibility, gives those norms more credibility.
And just pull some of those articles and see what they did. Mm-hmm. Yep. Makes sense. Thanks.
No problem. And the infamous Troy, what are your thoughts here?
I thought I wasn't speaking today.
Oh. Sorry, Troy.
I
just tagged you in, so it's not you can speak.
I think that to kind of piggyback on what Matt and Jamie said, I think, looking at frailty, it's one of the things that's being looked at a lot. And I think Jamie made a good point, and Matt did too, is, it's like a blood pressure. It's like a barometer. It's like a screening tool, obviously. I think it's important for articles like this to bring out that correlation between grip strength and mortality, because you're not going to go in the clinic with someone that has low grip strength like someone that's indicated in this article, and then you just make them do ankle pumps all day long and, squeeze the grippy balls and stuff like that. I mean, because even though, again, this is a correlation, not a causation. So just working on grip strength itself isn't necessarily going to get your patient better, not necessarily going to get that result that you're going to look for. So just these articles are great at, bringing forth that screening, that correlation, so then you can better focus on what the cause is later down the road after you screen them and identified them up front.
All right, Tori, I know you didn't want to talk, but you brought some really good stuff out in there. And I love that you brought up the screening because, for you and people's homes and for myself in the facilities, this is probably one of the easier ways I can test somebody for things. You know, like I can use a 1-rep max, you can use a 1-rep master things. We're not going to argue that, but it is very easy to take a grip strength and kind of get an overall reading of how your patient is doing. I'm really disappointed to learn that I can't just grippy ball, squeeze, and ankle pump my way to health. Like, this is shocking and terrible for me. Troy just destroyed my dreams. In all seriousness, like I said, this is a really good screen. It's a good thing to look at. Another thing that I wanted to point out, we talked about this in an article that Dustin read, is that we don't understand, and this article doesn't say that it understands the underlying why this occurs. It's not giving us causation. It's just stating that they are seeing a correlation in grip strength and mortality. And I think that's important too. Like, we're not going to get all the final answers out of here, but we do have a good place to start from as people are looking for more answers, as the research is looking for more answers. And by looking at this article, we now know that any other articles we find do have a good basis. They are well read, well researched, and we can go from there. So I find that very reassuring. Anyone have any other thoughts or ideas about this article? Any clinical draws, takeaways, anything like that? No? All right. Well, it has been great discussing this with you guys. And thanks again, Game Changers, for chatting about another article, keeping research interesting for us. And it was good talking to you.
Hit me. Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.